Hi everyone, I'm Jenny Matthews. I'm the owner of State of Mind Therapy. In this video, I'm talking about generalized anxiety disorder. I'm going to talk about how it affects somebody's thoughts, how it affects them physically, and then behaviorally as well. Let's get started. So somebody that has generalized anxiety disorder often would describe themselves as a worrier. That's oftentimes a common sign to me that someone might have generalized anxiety disorder, and that they would say that I worry about everything. It's not like one thing in particular, it's a lot of things and it's all the time. So it's really important to know that how somebody thinks when they have generalized anxiety disorder is a lot of what if thoughts. So it's like, what if I'm late? What if they don't like me? What if my husband gets in a car accident? So tons of what ifs, all about future events. Another common way that someone might think with generalized anxiety disorder is a snowballing kind of thinking pattern. So for example, somebody might have anxiety about a test, and so they have the thought, what if I don't pass this test? And that then leads them to go, if I don't pass this test, then I might fail this class. And if I fail this class, then I'm not going to be able to graduate. And if I don't graduate, I won't be able to go to college. And if I don't go to college, I'm going to be unemployed. I'm going to be embarrassed and ashamed, and people aren't going to like me. And so you can see that from this one worry, it really snowballs into a ton of worries. So that gives you a little sense of the worried thinking. And then physically, this really can be different for everybody. So anxiety affects everyone differently physically. It can even vary by the, I don't want to say by the day, but the actual worry situation. So you might get tight cramping, you might get nausea, you might get diarrhea or even constipation. You could have headaches, trouble concentrating, trouble sleeping. These are all really common signs. And there's a lot of other ones. So almost any physical complaint could potentially be related to anxiety. So anything that's maybe unexplained by a medical condition should always be checked out if anxiety is related. Okay, some other common signs are behaviorally. So some things that you might do that could indicate generalized anxiety disorder. For example, anything that might make it hard to deal with uncertainty. So oftentimes people with generalized anxiety disorder, they need to know and they're unsure of themselves, and so they need to have some 100% certainty in order to move forward with something. Could be like a decision to make. So for example, somebody that is struggling with uncertainty might do a lot of reassurance seeking. So if your doctor says, nope, that spot on you is not cancerous, you're good to go, you might feel that you need to then go to another doctor and another doctor and another doctor because it's not enough. You might ask a lot of what if questions to your loved one before going, to a social event. Well, what if we're late, and are you sure, that so-and-so's going to be there? You sure we'll be able to, leave in time? It's a lot of seeking that reassurance from somebody else to feel better. Another one might be information seeking. So if you're worried about something, you might, read every possible book on this situation so that you make sure that you are 100% informed and can make 100% the best decision. You also might have a really hard time with making decisions, and you might just choose to not make them at all. So you would always maybe put them on someone else to make. List making, like excessive list making. For example, you might not even be able to go to the grocery store without like having that list because you don't want to mess it up, or you won't delegate something because you don't feel that anyone else would be able to do it just right. So a lot of these are kind of perfectionistic tendencies as well. Another one is keeping really busy. So like really having a hard time with allowing yourself any kind of downtime. You're always overscheduling yourself or making sure that you're constantly busy so that you keep your mind distracted. All an effort to not think about worries. So that is a little explanation of what I see most common with my clients who have generalized anxiety disorder. If you are interested in learning more, please feel free to visit me at my website at stateofmindtherapy.com. Thanks everyone. Bye-bye.